RunBuzz, episode 128. In this episode of the RunBuzz podcast, we dig into the topic of shin splints. Shin splints are fairly common among new runners or experienced runners who suddenly increase their distance or training intensity. In this podcast, we're going to discuss what shin splints are, what are the symptoms of shin splints, what causes them, and how to get rid of them and keep them from coming back. All this and more coming up on today's show. Hey, welcome to the RunBuzz podcast. My name is Steve Carmichael and I'm your host, and I am so glad you're joining me today. I'm excited because at the time I'm recording this, we're coming up on the peak of race season. So we're still a few weeks out, but I'm starting to see race results come in from some of you and see those race goals that you've been hitting. And a few runners I coach had their final long runs before their taper actually kick off today. So excited to see where things are going, and I'm starting to get antsy. We also have our next RunBuzz community meetup coming up in a few weeks at the Columbus Marathon, so I'm pretty excited to see those of you who are going to make the trip in, and hopefully get to spend a few days with you guys as we celebrate and have a lot of fun. I think the furthest person, actually I know the furthest person, is traveling from Australia, which is awesome, but we have people coming from surrounding states as well, and the East Coast. And so, yeah, I'm just excited in general to see what you guys are doing in the Facebook community. And I love seeing those medals and photos of your race as well. So going to jump right in. Today's podcast topic comes from a recent listener question who wrote to me through our Ask the Coach opportunity that's part of the Free Runners Toolkit, which you can get over at runbuzz.com. And the question was essentially this: how do I get rid of shin splints? What causes race as well? So going to jump right in. Today's podcast topic comes from a recent listener question who wrote to me through our Ask the Coach opportunity that's part of the Free Runners Toolkit, which you can get over at runbuzz.com. And the question was essentially this: how do I get rid of shin splints? What causes them? And can I run through shin splint pain? Well, that's what we're going to discuss today. So probably the best way to get started is let's talk about shin splints. What are shin splints? So shin splints is an overuse injury that can be quite painful and equally frustrating. And pain typically occurs when there's inflammation in the muscles and tendons and bone tissue that surrounds your tibia. And more specifically, it's where these tendons are attaching to the bone tissue. Now, the tibia is one of two main bones that are just below your knee and above your foot, but most of us frequently refer to it as our shin bone. So along our shin bone, or our tibia, there's two primary muscles: the tibialis anterior muscle and the tibialis posterior muscle. And the tibialis anterior muscle is the primary muscle that we use when we lift or lower our foot. So if we're sitting in a chair and our feet's planted on the ground and we want to lift our toes up as we lift our foot up, that is the tibialis anterior muscle. The tibialis posterior muscle, this is what helps support the foot during our weight-bearing phase when our foot strikes the ground and as our foot naturally pronates to absorb the impact. And a weak tibialis posterior muscle can lead to arch collapse during the weight-bearing part of our foot strike, and it places additional stress on our lower leg, where again, those tendons tie into the bone. Now, since running is a high impact activity, these two muscles, their tendons and the bone tissues that they connect to, it often gets inflamed and painful when we try to do too much before our body has adapted to running, or the new onset of increased activity for an experienced runner. So let's talk a little bit about the symptoms of shin splints in runners. So when experiencing shin splint pain, the pain is most often felt on the front or inner edge of your shin. If it's more towards the front or the inside, it's more likely anterior tibial stress syndrome or anterior shin splints. And if it's more to the inside or the back, it's most likely medial tibial stress syndrome or posterior shin splints. And it has a lot to do with those muscles that I was just talking about and where they attach. So shin splint pain often feels like tiny little razors or sharp razor-like pain that's digging into your bone. Other early signs of shin splints can be often referred to or described as dull or a throbbing sensation in the area. In fact, you can often press and feel a sore spot by pressing around the area. And I sometimes refer to these as hot spots. We start feeling the shin splints and this dull throbbing sensation kind of pop up. Sometimes if we pushed too hard, and again, maybe we weren't doing speed work and all of a sudden we started doing speed work, or we started drastically increasing our running, or we came back after a time off, or maybe we're a new runner. And those hot spots tend to pop up, and if we catch them early enough, we can often reverse them. Otherwise, they can go into shin splints. Itself usually starts during a run and can last throughout the run and even after the run is over. Often the pain during a run becomes severe enough it could force you to stop running. If you've ever had shin splints when you first started out running, you know that they can be painful. Now, it is also important to note that there's other things that contribute to shin pain. Not all shin pain is just shin splints. If your pain doesn't resolve fully or doesn't show signs of improvement after a few days or to a week, or if your pain is extreme or the area is showing signs of swelling, or the pain does not resolve with rest, then you probably need to see your doctor and have your lower leg examined. Overuse injuries like stress fractures, some tendinitis, and a few other issues can feel very similar to shin splint pain. So when chronic inflammation occurs, shin splints can progress into tendinitis, larger tears in the tendons or muscles, and even stress fractures as the bone starts to break down itself. So having said all this, remember, I'm a running coach, I'm not a doctor. So if you're not sure what you have, please go get it checked out. Go see a sports doc, go see a physical therapist. Those are usually the best people to go see. And by doing that, it's better to know for sure so that you can properly address the right injury rather than making it worse. Now, shin splints, for the vast majority of runners, can be turned around and dealt with typically through self-treatment. But again, if you're not sure, get it checked out because it could be other things. So what causes shin splints in runners? Well, shin splints are first and foremost an overuse injury. Let me repeat that again because we often look for other causes for shin splints, but first and foremost, it's an overuse injury. Shin splints can be aggravated by lots of things like poor footwear, having flat feet, or a poor foot anatomy such as rigid arches, but shin splints primarily come on due to sudden changes in activity that increases stress on our bones and tendons. So if we think about running, we're repetitively over and over again using our muscles, tendons, joints, bones, and so on. And as the muscles pull on these tendons, it starts to create microscopic tear and inflame the tendons, especially at that point where it's attaching to the bone. So that's essentially that repetition over and over again is what's causing shin splints, because we haven't adapted our body to be strong enough to prevent that microscopic tear and inflammation in our shins. Now, new runners are often the first to get shin splints, and it's more common in brand new runners because often as a brand new runner, you're motivated, you want to get out, you want to get started, you're finding yourself, excited about having a new fitness routine, you're motivated, it hasn't turned into a grind yet, so you just go out and you're just doing too much early on because of this motivation. And you often will start to feel good about 3 to 4 weeks in because your cardiovascular system's starting to get results, and you feel like you can run farther and farther. And so you do, but again, it'll go back to the fact that it takes time to build up strength. It takes time, the protection that you need against that impact. And over a period of time, it starts to break down and then injury occurs. Another common thing is that sometimes new runners will go out and run day after day with no rest. In fact, experienced runners do this from time to time. And running too much and overdoing it too early, again, is going to cause all the things to happen that can show itself in a number of different ways, whether that's shin splints, stress fractures, tendinitis, all the class of overuse injuries. And if you think I'm an experienced runner, or you're an experienced runner, and it's like, okay, well, I haven't had shin splints. That's good. That's awesome. In fact, we see less shin splints in experienced runners, unless all of a sudden you drastically ramp up your distance, you ramp up your intensity, you change maybe the surface areas you're running on. So if you're running primarily on treadmills and then all of a sudden you go run outside, well, guess what? That change from the treadmill to outdoor running has turned into a different foot strike pattern, has turned into a harder surface, and so on. And so all this stuff can contribute to shin splints. Maybe you're primarily a trail runner, a bike trail runner. You run on bike trails, you run on pavement, and then all of a sudden you take up trail running where you're running more on uneven surfaces. That's another time where sometimes we'll see shin splints pop up, is because we're now hitting different areas of our muscles and our legs when the surface changes, like we're running on rocks and roots and stuff like that. So just be aware that even as an experienced runner, you can develop shin splints. So what are some things we can do to get rid of them? Well, around for tips on getting rid of shin splints or any overuse injury, you probably come across dozens and dozens of different suggestions. And this is especially true if you've been searching around on forums and in social media. And I often cringe when I see some of the advice. Everything from changing shoes to foam rolling to whatever, you will be thrown out there often. And often those are certainly things that can certainly help. But getting rid of shin splints themselves is actually a fairly straightforward process. First and foremost, before we do anything else, we need to apply the Rice principle. And the Rice principle we'll talk about in a minute is designed to allow for rest, ice, compression, and elevation. Those are things that stands up for the acronym RICE. And once we've done that, then and only then do we work on flexibility and strength training once the injury has had a chance to start healing. If you go straight to flexibility and strength without addressing the rest and the ice and so on, you could actually make the injury worse. So a couple things I want to talk about: running through shin sprints or going straight to flexibility and strength training before you had a chance to heal is probably some of the most common mistakes runners make when it comes to addressing the shin splints themselves. So let's talk about RICE a little bit. So first, R is rest. Since shin splints are an overuse injury, we need to first dramatically reduce the level of activity. This usually means taking a few days off from running and possibly incorporating some other forms of low impact training like swimming or cycling. In more experienced runners, sometimes just taking a couple days off and then maybe walking. For a day or two, followed by a slow, gradual ramp up back into your training is enough to get over shin splints. For beginners, on the other hand, it may take additional time off. It may take a longer, gradual comeback, more run walking and less solid running. It may require more flexibility and strength training to help build up those muscles and flexibility. So, strong muscle is an injury-resistant muscle, and it's going to help your body absorb the impact of running itself. And a flexible muscle is going to help reduce the tension applied on the tendons and bones, so that when you are running, you're not pulling. We've always talked about having tight calves or tight quads or tight hamstrings. When those things are tight, they're pulling harder on the tendons and the ligaments, or primarily the tendons. And those things is what tends to cause the tendinitis and the overuse injuries. I in RICE stands for ice. So inflammation, especially right after exercise or injury, can be reduced by frequent icing. So using cold packs or baggies filled with ice and then applying it to the area off and on throughout the day will certainly help with that inflammation and encourage the healing process to start. Now, it's important that you do frequent icing. Icing immediately after exercise is certainly helpful, but if you don't do anything the rest of the time, the inflammation can return. So one other thing, never apply ice directly to the skin. You can actually get frostbite from that. So use a hand towel or something to act as a barrier. I like to use paper towels because it gives you a little bit of a barrier, but you feel like you can get some of the ice, the cold to come through. But you want some sort of barrier between the ice and your skin. C for rest, ice, compression. So Compression socks after exercise can help, especially with shin splints and calf pain, but it's often not needed. It's it's debatable about how much it helps. So I think it's kind of on an individual by individual basis and the type of injury you have. But compression can help reduce inflammation as well, or more specifically, it helps increase circulation and helps push the lymphatic fluids, the waste products out of the area. So when you have an injury in the area, you tend to accumulate fluids. That's the swelling you feel. And by using compression combined with the last one, elevation can help push those fluids out of the area so that they can be reabsorbed by the body. Last one I just mentioned was elevation. I don't think with shin splints, I don't think it's really that important or that useful. But if you have the opportunity to lay down and elevate your feet, maybe while you're icing or applying compression, certainly wouldn't hurt. But shin splints rarely have swelling. So I think the compression and the elevation is not as effective as the rest and the ice. Now, beyond rest and ice, I would encourage you that after you've been icing and resting and you've cut back and you've dealt with the too much part of the running and the injury is to use strength training and flexion splints. So light stretching and simple strength training exercises can help with increased flexibility. It helps with building strength. It's going to help strengthen the area, help your body better absorb that impact of running. I have a whole strength and flexibility routines designed specifically for runners and injury prevention itself inside the Pace Builders membership area for those of you who are using our training plans and coaching. But some of my favorite exercises to get rid of shin splints involves various single leg balance and stability drills, calf stretches. I like the gastroc calf stretch, heel drops and heel raises for general overall strengthening of the calf muscles, hamstring stretches, hops and jumps and Bosu ball exercises are also good once you've built kind of some basic strength. Those give you some opportunity to increase with a little more intensity, but I wouldn't start with hops and jumps and things like that until you've built up some sort of strength in the area. But before you introduce stretching and strength in the treatment mix, please give your legs a few days to start that healing process, and certainly cut your training volume back. No amount of foam rolling and stretching and strength training alone is going to help you heal. The biggest thing you can do is cut back the training volume. Those other things can come back in, but you have to deal with the training volume. You have to deal with the healing process and get that started first. Otherwise, you can actually, again, make the injury worse. If you need help with a training program that's going to help balance the right level of training with your experience level so that you can meet your running goals and minimize your chance of injury, I'd encourage you to check out my Pace Builders training program. We work with runners all the time who are trying to overcome injuries so that they can get back to their training. And shin splints is very common, and we have a lot of experience, especially with the new runners we coach, helping them get over those and back into running. Now, this question I'm going to add this in. It wasn't part of the original question that the listener sent in, but I see this a lot. Can shoes or orthotics help with shin splints? And the correct answer is maybe, possibly, probably, depending on what is actually being corrected by the shoe or the orthotic itself. So while most advice on the topic is well-meaning and can be sometimes helpful, the reality is, shoes and orthotics rarely by themselves solve any running injury. They're nothing more than just a tool. And so orthotics can help if someone has really high arches or flat feet, but the vast majority of runners outside of this group don't need them. Using them temporarily, however, has been something that I've used when working with clients, is to use a temporary orthotic, but that's mainly to help temporarily remove the stress in a particular spot of injury so that the overall load is lowered in that area and offset and moves it to somewhere else, thus giving the injury time to heal. And so using orthotics with things like high arches can also help prevent against that arch collapse that I was talking about, or more commonly known as overpronation. If you think about as you land on your foot slightly turns from the outside of your foot towards your big toe. If it lines up and stops big toe, if it lines up and stops at the point where your big toe lands, that's great. That's normal pronation. But if you continue to roll past that to where your ankle's rolling in, then you're getting a foot collapse there or overpronation. And where we also see sometimes this is when we overpronate, it creates added tension on the bottom of the foot between the toes and the arches. And sometimes that's a cause for plantar fasciitis in runners, especially runners with high arches. So again, even in that case, plantar fasciitis is an overuse injury and is almost due to a training deficiency, unless it was caused by a sudden tear due to weakness or failure in the muscle or fascia itself, which then caused the strain. For the same reason, shoes may or may not work. Certainly changing your running shoes as often as you can is important because the cushioning starts to break down fairly fast in running shoes. Most running shoes should be changed anywhere between 300 and 500 miles. If you're a heavier runner or you run a lot, then it should be on the lower end of that. If you're a lighter runner or a lot of those miles are walking miles where there's less impact, then you can get a little more miles. It could be more the upper end of that. But sometimes you'll hear people get shin splints and they'll say, hey, go out, change to a new style of shoe or a new brand of shoe. And that can work. But it's working because in most cases, it's simply shifting the stress slightly to another area, which is then giving your shin splints time to heal. And then hopefully, as you ramp back up, your body adjusts to that new style of shoe, and the new stresses or the new stress locations that shoe then puts on your feet and legs. So changing your shoes, adding an orthotic, certainly worth a try. And again, you do that in combination with significantly cutting back your volume first, giving your feet time to and your legs time to rest. So at this point, we have talked about what shin splints are. We've talked about the signs and symptoms of what they are. We talked a little bit about strength training and RICE and how we can start treat shin splints. We talked a little bit about orthotics and shoes. Last thing is how to return to running after shin splints. So when returning to running after experiencing shin splints, the process, regardless of whether it's shin splints actually, the process needs to be methodical and slow. So before you resume running, you should be pain-free at least for a few days to a week. With something like shin splints and overuse injuries, you don't want to rush back. If your shin splints were severe, you may need to wait 2 weeks of pain-free before you return. So when you return, start by doing a 10 to 15 minute dynamic warm-up. And again, I have routines inside Pace Builders for this, but you want to find exercises that slowly increase your heart rate and involve movement. You want to warm your muscles up, and you do that through movement. And you want to get the blood flowing. You want to get the oxygen flowing to your muscles and essentially warm up your muscles. And this is not stretching where you stretch and hold. So jumping jacks are just a few examples. Most of us sometimes or usually skip the dynamic warm-up and we just take off running. Or we take off running and we run and say, well, I'll just take the first mile slow. That's my warm-up. Then after the dynamic warm-up, do some easy walk-run intervals on that first day back. And it's really to test the shin pain. If the pain returns, you need to stop the activity for the day and then go back to repeating the process that we talked about. Go back to RICE, rest, elevation, wait till you get pain-free for a few days. Continue at that point working, if you were working on strength training and flexibility, you should do that all the time, whether you have shin splints or not. But you do that and then try it again. And you may have to repeat this process a few times. Once you can run and walk pain-free, then you can slowly resume back to your training volume. And I recommend when you're starting back after an injury, start from about 50% of your pre-injury volume if you have not been off more than a few weeks. And then from there, you slowly increase over the next 2 weeks until you're back to pre-injury volume. In some cases, you'll be able to come back a little faster if your time off is a little shorter, but always pay attention when you're running and you're returning to running if the pain returns. Shin splints are not the type of injury that you can run through. It just continues to make it worse. And if you make it through most of the run before the pain returns, so let's say you have a 3-mile run and before the pain returns. So let's say you have a 3-mile run and you're 2.5 miles in before the pain comes on. Go ahead, cut the run short, and then try again in a couple days and plan to run that 2.5 mile distance or whatever point it was where the pain returned, and maintain that for a couple days. And then if you don't have issues, then start pushing forward again. So if you can maintain that distance without pain, slowly add in additional distance for your subsequent runs. And then after a couple weeks, you should be back into business and you should be pain-free. But running through pain is only going to make your shin splints worse, or even worse than that, it can lead to more severe chronic injury. All right, guys, that wraps up this episode today. I want to thank you for tuning in. Hope you got some use out of this. I know there are a lot of runners, especially new runners out there, struggling with shin splints. When you come across one of those runners, if it's not you yourself, then would you please share the RunBuzz podcast with them? Share episode 128. Over on our website, I actually have a article. It's a couple thousand, maybe 1,000, 1,500 words long. That is all the notes from everything I just talked about, written in an article format. Makes it really easy to share. Also, there is a video at the bottom. So at the bottom of the article, there is a short, 5-10 minute video from Bob and Brad. Now, Bob and Brad are two physical therapists who have this awesome YouTube channel. If you are injured or have interest in injury and injury prevention, I encourage you to check out the show notes page for this site, runbuzz.com/128. That's the episode number, runbuzz.com/128. At the bottom of the article, there is a routine that they put in, how to cure shin splints in about 5 minutes. Now, that's not like do it once and it's 5 minutes and it's all done, but it's more of like how you can do it with 5 minutes each time you have time to set aside to work on your shin splints. It's a really good video. They're pretty fun to listen to. And if you suffer from other injuries, still check them out, because their YouTube channel has a ton of really, really good videos that walk through very simply what injuries are, what a particular injury is, how some tips to know whether you have a stress fracture or you have shin splints or things, just a wealth of information. So it's a great YouTube channel, and I encourage you to check it out. And with that, I'm going to wrap up again. Thank you so much for joining me. If you thought this episode was helpful, I could really use your help if you have like a minute to head over to Apple Podcasts or whatever app you're listening to us on, and just, if you can, leave a 5-star feedback and some comments on how this podcast has helped you. That would really help get the word out. Again, I appreciate you taking the time to do that and leaving your feedback. It helps me become a better podcaster and provide better episodes, and it helps get the word out. So thanks again for joining us. We'll see you next time. I got a great interview coming up with a physical IT band syndrome and how you can address it, but that'll be coming up in a few weeks. In the meantime, guys, keep running, keep sharing those positive pictures, those race medals, keep sharing them in the Facebook